Yes, you're welcome. After understanding diabetes and some of the risk factors to diabetes, we want to discuss about how do you know or how do you diagnose diabetes mellitus. So in diagnosis of diabetes mellitus, we start with the symptoms. There are some symptoms of diabetes mellitus. Some of them are acute, that they are so fast, and then others come as a long-term effect of diabetes mellitus. And these symptoms may actually include increased feeling of thirsty, what we call polydipsia, increased feeling of hunger, what we call polyphagia, and then there is also polyuria, where someone produces or urinates too much urine, especially in the night. And then there is also increased feeling of increased dry mucous membranes, what we call dehydration, as a result because someone is producing a lot of urine, so they get dehydrated and they get those dry mucous membranes, dry lips. And some of the long-term effects of diabetes, actually especially diabetes type 2, people always delay to make diagnosis because there is some insulin that is there. So these patients always come with long-term complications such as non-healing ulcer wounds. They come with peripheral neuropathies, they come with pins and needle sensation, they come complaining about numbness of their feet, paralysis. Some of them come with strokes because diabetes is one of the causes of the cardiovascular accidents. Some people come with high blood pressures, and others come with complaints of blindness because diabetes causes blindness. So the people come with symptoms. So those are some of the symptoms of diabetes, starting from the acute and the long-term complications. When we go into the lab, after identifying some of these symptoms, someone comes with those symptoms, so we go into the lab. There are around 3 or 4 tests that we do to confirm diabetes. There's what we call random blood sugar. That is done when someone last had a meal 2 hours ago. When you go into the lab, we test your blood sugar and we find that, because the normal ranges are between 4.5 to 11.0 millimoles per liter. That is in millimoles. So if someone comes and we measure their blood sugar and they are between 7.5, they are between 4.5 to 11.0, they're in normal ranges. However, when they are between 7.1 but less than 11, they're in normal ranges, but they are pre-diabetic. Anytime they can get diabetes. So for us to confirm that you're diabetic, if you have any of those symptoms that I've talked about and your blood sugar is more than 11.1 millimoles and above, we confirm that you're diabetic. That is one test. There is also another test we call a fasting blood sugar. Fasting blood sugar means that someone has fasted for more than 8 hours from the last meal. So if you had your meal and 8 hours have elapsed, we do your fasting blood sugar. Ideally, the fasting blood sugar, the optimal ranges should be between 3.5 to 5.5 millimoles per liter. For example, that blood sugar in the morning without eating anything at around 6 to 7 a.m. So if we find it that it's beyond 5.6 but less than 7.0, you're not diabetic, but you're in a state of becoming diabetic. You're in a state called pre-diabetes. But if your blood sugar in the morning is reading 7.1 millimoles per liter and above, plus any of those signs that we talked about of feeling thirsty, increased urine production, especially at night, increased feeling of hunger even after eating, so we confirm that you're diabetic. There is also another test that we call HbA1c, what we call glycosylated hemoglobin. That is the test that helps us to diagnose diabetes, because it's a test that tells us how your blood sugar has been in the past 3 months. So the normal ranges of that HbA1c is around, it should be less than 6.4%. It's in a percentage. So if it's less than 6.4 but above 5.6, that means you're not diabetic, but still you're in a pre-diabetic phase. But if it's less than 5.6, that means you're not diabetic. So we make diagnosis of that basing on the symptoms that you have, plus an HbA1c of more than 6.5%. HbA1c just simply tells us that how much glucose have you been having in the past 3 months, because glycosylation, just like that, you can get a bread and then you glycate it with what? With the Blue Band, Prestige, something like that. So the percentage of your hemoglobin is found in your red blood cells. The percentage of your hemoglobin glycosylated or glycated with your blood sugar. If it is high, it tells us that you've been having too much sugar, so we can make a diagnosis of diabetes. The other is called oral glucose tolerance test. That one is very important diagnosis of diabetes in the pregnant women, whereby we get a pregnant woman, we give them a glucose meal that is 75 grams. We give them glucose, oral glucose 75 grams. We give them 2 hours and then we measure. We can also do 100 grams test. We give you 100 grams test of glucose. After 2 hours, we measure your blood sugar. We measure before we give you, and also we measure after we give you. So for example, if we measure after giving you glucose 2 hours, and we find that your blood sugar levels are more than 11.1, they are 11.1 and above, we make a diagnosis of diabetes in pregnancy. If it's less than 11.1 but more than 7.1, that's when we make a diagnosis that you're having a pre-diabetic state, or what we call an impaired oral glucose tolerance test. We also have, for example, if we do give you glucose 100 milligrams before measuring you, and we find that you're having 6.1 millimole, but less 6.1 but less than 11, still we make a diagnosis that you already have an impaired blood sugar levels. So that's how we can diagnose diabetes based on the lab investigations and the symptoms.